Dr. Robert Jones from Metro Health Medical Center, and in this Case Med Minute Physical Exam Challenge, we're going to go over a case of diplopia in an elderly diabetic male. This patient presented with complaints of diplopia. He states that he had been doing well until about 2 days prior to arrival. He states that he has a history of hypertension and diabetes, both of which have been in good control. He states that he's had no recent fevers or infections. He denies any headache. He denies any difficulty in speaking, denies any confusion, denies any slurred speech, denies any focal weakness. On physical examination, here you have him looking directly at you. Can you tell what the key physical exam findings are here, and can you tell what cranial nerve is affected? If you're ready to go on and find out what the answer is, let the video continue to run, but if you want a little more time looking at this image, then hit the pause button. The answer in this case is cranial nerve 3 palsy. In terms of patients presenting with diplopia, you have to remember that the 3rd, 4th, and 6th cranial nerves innervate the extraocular muscles. And extraocular muscle paralysis is going to result in misalignment of the visual axes, and these patients will complain of diplopia or double vision. This is pretty disabling for patients, so these patients will usually present right after the onset of the symptoms. In terms of 3rd nerve palsies, the pupil is going to be down and out. This is the classic thing you'll hear about 3rd nerve palsy, the down and out pupil. And that's because the abducens and superior oblique muscles are still functioning. You may also see ptosis, and you may also see pupillary dilatation. Usually in patients with an ischemic etiology for the 3rd nerve palsy, there's not pupillary dilatation. That usually occurs when there's a compressive lesion. Now, the cause is an aneurysm of the posterior communicating artery, and this can be and you can see the diplopia in either cases of rupture or even in non-ruptured states. This can also be caused by tumors compressing the 3rd nerve or ischemia. This is most commonly due to hypertension or diabetes. Now, the workup, the most important thing you're going to want to do when patients present like this is to rule out an aneurysm of the posterior communicating artery and a subarachnoid hemorrhage. So in these patients, you can get a CT scan first. You can also then do a CT angiogram to look for the presence of the aneurysm. In cases where you cannot obtain a CT angiogram, an MRA would also be helpful in diagnosing the presence of a posterior communicating aneurysm in these patients. Management of these patients, it's going to be surgical if the etiology is a posterior communicating aneurysm, and it's going to be medical if it's ischemic. And by medical, for the most part, we mean watchful waiting. You're obviously going to want to have these patients do good blood pressure and diabetes control. In the meantime, while waiting to see if this resolves, patching the affected eye can be helpful since this will eliminate the diplopia. Now, if we go back to the image here of the patient staring straight ahead, you'll notice a couple things. Number one, you can see that with the patient staring straight ahead, that the light from the camera flash is directly over the pupil of his unaffected eye, but you can see here that the light from the flash of the camera is offset from his pupil. You can see that he's down and out here, and this is the affected eye with the cranial nerve 3 palsy. What you'll also notice is that there's the ptosis or the lid lag here present. Remember, we also said that with cranial nerve 3 palsies, you may also see pupillary dilatation, but if you look here, you don't see that. You can see that the pupils grossly appear equal in size. While not in absolute, usually pupillary dilatation is going to occur in patients with compressive lesions, whether from tumors or aneurysms, as opposed to patients who have ischemic etiologies. And you can see here the patient staring to the right, and you can see the effect of the cranial nerve 3 palsy here, and obviously the misalignment of the visual axes and the obvious diplopia that this patient would experience. This concludes the Case Med Minute Physical Exam Challenge.